Simone is here today, and she's a beautiful young lady who has some evidence of sun damage, but her biggest problem is a little bit of pigmentation, which is blotchy. This can be caused just from some exposure. It can be caused from hormonal changes, whether it be birth control or just hormone imbalance in the patient, as well as some medications or pregnancy. So our goal today is not necessarily to treat her very aggressively for wrinkles, but mostly to try to address the pigmentation. The nice thing about this laser is that it treats pinpoint areas of skin randomly in a way, and I'll show you a picture later, to cause a column of heat that penetrates down into the skin, removes that dead cells, the pigmentation in the skin in that one column, but there's enough normal skin around it that within a few hours it heals up. So there's no oozing, there's no crusting, there's no bleeding. You get an initial swelling and redness, which occurs pretty much instantaneously, which lasts the first day, and then by the next day you're getting like a bronzed, like almost suntan look. And then in maybe 10 to 15 days, if you rub your hands on the skin, you may feel like a little grainy, like fine grains of sand. That is those little columns of skin that are moving out. We can treat any part of the body, the face, neck, chest, the back of the hands, essentially anywhere that the patient wants to be treated. We can treat all skin types, whether it be light colored skin to skin of color.
The first step is to apply the numbing lidocaine.
So we had removed, as you saw previously, the topical anesthetic, and now we're putting on what we call a tracking gel that allows the handpiece of the laser to move freely on the skin. So here we have the handpiece, and this basically is where all the energy comes out of. We put the tip on, and this tip here has special rollers that roll across the skin, and you can see the red beam, and that's basically where the laser energy is going to come out. You look over here on the screen, we have various different settings. We have an energy that can go as high as 70 joules and as low as 0. The area that we're going to be treating today will probably be in the range of about 20 joules. The treatment level is what we control the density of the little spots. If you think of it, and I'll show you the diagram, these are little spots that are going into the skin, so we'll treat at an energy treatment level of about 8, and the number of passes that we'll do on a specific area is going to be 8. And all of this basically gives us the parameters that we want. The depth of each little pass is going to be about 800 nanometers, or a little bit less than a millimeter in depth. What we're going to do now is we're going to measure the amount of surface area that she has on her skin, on the face, and you can see the computer of the machine allows us to do so. So we're going to measure the length initially here, and this is not going to be painful. This is just to kind of calibrate the amount of energy that we're going to need in order to complete the treatment. We do that by grabbing the skin here, putting a little tension behind it, applying the handpiece here, and slowly pass the handpiece across the face. It gives us about a length of about 13. Now we're going to switch to the width. We're going to do the same thing here. We're going to measure from the side of her face centrally, and that gives us about a total area of about 218 centimeters. So in order to treat her at this energy level, we have an estimated amount of energy of about 4 kilojoules that we're going to treat. And as we go along, you'll see that the actual kilojoules will start to advance, and that's what's going to determine the amount of energy we've done on this treatment level. We use this machine here, which is called a Zimmer. Basically, is like a giant refrigerator or air conditioner that blows a column of cold air that the patient can maybe help me by holding it in the areas that we're going to treat. It's a good way to distract as well as to minimize any type of heat discomfort she may feel. We're going to begin the treatments here on the side of the face, and she'll start to feel a little bit of like little pinpricks of heat. How does that feel, Simone?
So far, so good.
She had the topical anesthetic on for a few hours, about an hour and a half, so she really should feel minimal discomfort. If we treat higher energy, she may feel a little bit more, and in some of those patients, we need to give a little bit more of a type of oral medication, whether it be a small amount of Valium or a small amount of painkiller to try to help the patient through. Certain areas of the skin are going to be more sensitive, such as the areas around the eye. You can see that we do 2 passes, one going in the up direction, and then go ahead back in the same place, going back. And we try to cover the entire skin surface in a very controlled, even, slow pace so that we minimize the discomfort and get the maximum treatment. After the treatment, we try to give the patients a little bit of a cooling mask. We have them try to strictly avoid the sun, because anytime you do any type of laser treatment, if you have a lot of sun exposure, we can get what we call post-inflammatory pigmentation, which is obviously what we're trying to eliminate here, so we'd hate for her to get any of that. So we try to make sure they use a good sunscreen on a regular basis, whether they're going outside or not. The ultraviolet light can penetrate through your car window, can penetrate through the window of the buildings that we live in. Certainly if you're driving to work or going out to walk the dog, that little bit of sun is enough to create problems, so we want to make sure that she is well protected. Fluorescent lights in offices, sometimes computer screens, can also create some UV or ultraviolet irradiation, which can then lead to pigmentation. So it's essential that patients basically wake up, brush their teeth, wash their face, and apply an adequate sunscreen every day. The sensation is a sensation of heat and maybe a little bit of prickling, kind of like a static electricity shock. But once we stop the treatment, it's just a little bit of heat and a little bit of swelling, and really patients don't complain about pain after the treatment. It's really a little bit of discomfort during. I've had really nobody that has been unable to complete the treatment because it's been that uncomfortable. There's no danger at all of going on the eyelids. There's no danger with this particular laser of going over the hair areas. This is not a laser that's going to create hair removal, and patients have been happy. The nice thing about it is that she could put her makeup on and go to work today if she wanted to. She'll be a little bit swollen, but certainly nothing that's going to keep her from looking beautiful. And tomorrow, take a shower, do everything like normal. There's no reason to worry about any bleeding or crusting or oozing or anything that would give her some discomfort or inability to be able to function at work. So we've essentially completed the treatment for today, and then Joanna, my esthetician, is going to come in and do a little cooling mask treatment so that the patient's more comfortable. Thank you.
Thank you, Dr. Zaiac.